Hey everybody, just wanted to go through some exciting new stuff that we have going on in our office. So, a couple weeks ago we got the Shockwave device. It's really exciting because not only, can we address, spinal issues and working on the joints, but now we really have a game-changing piece that we can improve the function of tendons and tendinopathies as well as muscular conditions like never before. So the nice thing about this device is it opens us up to being able to better treat things like tendonitis of the shoulder, patellar tendonitis or tennis elbow or golfer's elbow, any of these types of conditions that are chronic in nature and a lot of times have lots of adhesions and lots of muscle pattern disruptions. Now we can quickly be able to get people back to whatever it is they want to do, whether it's being able to take care of their kids better, or if it's golfing or tennis or doing any activities outdoors. So we'll explain quickly the device. The nice thing about the device, like I said, is it's really quick treatment times too. So a treatment with the device is only going to be around 10 minutes. So we'll definitely try and warm up the tissue a little bit, but then we'll get into using the device to help break up those muscle fibers, as well as create a regenerative process into that tendon area. So not only is it helping break down, but it's really helping repair and regenerate that tissue, so we can avoid things like surgery and drugs that might be an ongoing cascade of constantly needing them. So here's the device itself. We've got different applicators, but we'll go through the main applicator now. So, what we're going to be doing is, just going through the surrounding tissue and using this device to, like I said, break up some of those adhesions and really kind of start stimulating that regenerative process. What you're going to be noticing is kind of different levels of pain at different areas, and that's a good thing. That's what we want. So we want to be able to find those tender and painful spots and be able to kind of isolate and harness a lot of that power into that area. So like I said, we can really get that muscle functioning better. So not only is it a great way to be able to use to break it up, but it's also a good tool to be able to find those areas to really isolate them well. So what we'll start with is ultrasound gel. Now this just kind of helps get those acoustic sound waves into the tissue better. So it's more of just a better conductor for that acoustic sound wave. So we'll turn the device on. We'll just do a couple seconds here just so you can kind of see what it will look like as well as what we'd be doing. So we turn on the device, that's the noise that you'll hear, and we will just be going along that muscle. So say if this is somebody that's got some forearm issues, we'd be trying to find those areas. For me, as we get higher up here, we definitely notice a little bit more increase in pain. So it's not the most comfortable device in terms of you're not relaxing, falling asleep for it, but it is something that's highly effective. People a lot of times will ask like how quickly you see results, and a lot of times in that very first session you'll notice a dramatic decrease in pain, as well as an improvement in range of motion and some of those other functional tests. Now a full treatment plan would typically be around 6 weeks or 6 visits. So that would be it, so one time a week for 6 weeks, and then that's it. This is something that you could do in conjunction with, physical therapy. So if you're already seeing a physical therapist for something like plantar fasciitis, you could be doing it with that physical therapy still being done wherever you're doing it. You could be something that you're coming in for chiropractic already, and now we can add in and work on some of those other issues. So things like plantar fasciitis, patellar tendonitis, jumper's knee, these are things that are really doing well with the Shockwave, and it's really exciting to be able to treat them. If you do have any questions though, give us a call, give us an email. We can send you information. Lots of studies being done, and there's more and more studies constantly being used as this technology evolves.